I am doing my topic on scoliosis. Scoliosis causes the spine to curve in the wrong direction. It causes sideways curves, and those are different from the spine's normal curves. If you were to look at your spine from the side, you'll see that it curves out at your neck, in at your mid-back, and out again at your lower back. Your back is supposed to have those curves. However, if you look at your spine from behind, you shouldn't see any curves at all. When there are sideways curves in the spine from this view, that's scoliosis. The curves can look like an S or a C. Scoliosis is generally associated with children, and it also affects most girls, but adults can have it too. This typically happens when scoliosis is not detected during childhood or the disease progresses aggressively. Most of the time, the cause of scoliosis is unknown. This is called idiopathic scoliosis. It is the most common type. Some people are just more likely to have curving of the spine. Curving generally gets worse during a growth spurt. Other types of scoliosis are congenital scoliosis, which are present at birth. It occurs when the baby's ribs or spine bones do not form properly. Neuromuscular scoliosis is caused by a nervous system problem that affects your muscles such as cerebral palsy, muscular dystrophy, spinal bifida, and polio. A normal spine has 4 regions. The first region is your cervical spine, which is your neck, and begins at the base of your skull. It contains 7 small bones, which are vertebrae. The second region is the thoracic spine, which is your mid-spine. It has 12 vertebrae. Vertebrae in your thoracic spine connect to your ribs, making this part of your spine relatively stiff and stable. Your thoracic spine doesn't move as much as the other regions of your spine, like the cervical spine. The third region are the lumbar spine. In your lower back, you have 5 vertebrae. These vertebrae are your strongest and largest vertebrae, responsible for carrying a lot of your body's weight. The lumbar vertebrae are also your last true vertebrae. Down from this region, your vertebrae are fused. Your last region are your sacrum and coax. The sacrum has 5 vertebrae that usually fuse by adulthood to form one bone. The coax, I know I'm not saying it right, most commonly known as your tailbone, has 4 but sometimes 5 vertebrae. There are 2 types of curves in your spine, kyphosis and lordosis. I know I'm not saying it right. Kyphosis means the spine curves inward. Lordosis means the spine curves outward. There are 2 kyphotic and 2 lordotic spinal curves in a normal spine. Your neck, which is your cervical spine, and your lower back, which is your lumbar spine, have a lordotic curve. Your mid-back, which is your thoracic spine, and pelvis, which are your sacrum, have a kyphotic curve. Your spine is made up of many parts. Your spinal column, also called your vertebral column, has 24 individual bones. Those are your vertebrae. In between the vertebrae, you have intervertebral discs that act like pads or shock absorbers. Each disc is made up of a tire-like outer band, which is annulus fibrosus, I know I'm not saying it right, and a gel-like inner substance, nucleus pulposus. Together, the vertebrae and the disc provide a protective tunnel, spinal canal, for the spinal cord and spinal nerves. The spinal cord runs from the brain down through most of the spine. Nerves branch off the spinal cord at intervals and exit through openings called the forearm. From there, nerves go to various parts of your body, helping you move and feel. The symptoms of scoliosis are backache or lower back pain, tired feeling in the spine after sitting or standing for a long time, uneven hips or shoulders, and spine curves more to one side. Severe spinal curve can reduce the amount of space within the chest, making it difficult for the lungs to function properly. That is all.